some certified physician assistants have been arrested by the police for picketing the Ministry of Health in protest against their delayed postings after 5 years of completing their course of study. According to them, despite several engagements with the ministry, there appears to be no sign of commitment from the ministry to get them employed, a reason they have resorted to the picketing. But they were sacked from the premises of the ministry while their leadership was arrested by the police. Samuel Mbura was at the Ministry of Health and reports.
These physician assistants, numbering over 50, came here as early as 9 a.m. in their numbers. They came from different regions with the main aim of getting or putting pressure on the Ministry of Health to absorb them. They say since 2018, the portal has been closed, and after completing school, life has been a hell for them. And that is why they are left with no reason than to come and picket, to show or to send a signal that they are not happy about the situation and that the health ministry should do something about it. But to their dismay, 3 of their colleagues were arrested and sent to the police, and the police have told them to disperse, else they will exert brute force on them. They are not quite happy about how they have been treated, and they think that the police could have acted more professional than they did.
But it's very sad because we are living in a country where police feels they can use their guns to intimidate health professionals. It is very pathetic because if the police wanted to communicate something to us, they could have done it in a more professional way than trying to use their guns to intimidate us.
Very unfortunate, totally unfortunate. We are Ghanaians and it is our right to picket. It is our right to demonstrate if things are not going on well. And so if the ordinary physician assistant who has qualified to practice medicine and dentistry in Ghana, and after 5 years of qualification is still at home, not doing anything, is coming to peacefully demonstrate and picket. And then the police says that we should leave and as a matter of fact, arrested our leaders. Then it's very unfortunate.
Boss speaks for the Ministry of Health, and we have him via Zoom now. Isaac, I'm grateful that you could join us here. So why arrest the leadership, people who are not picketing with guns? They are only there to register their displeasure.
Yes, good evening and good evening to your cherished viewers. One, the reason for the arrest of the leadership is something that I will reserve for the police service to respond to that. However, they were led here this morning by the same police officers. They came with the same police to come and inform us that they wanted to submit a petition to the ministry. We were not aware. Nobody informed us of their coming. All we know was that they came in their numbers with the police accompanying them. We welcomed them, and then we received the petition on behalf of the Honorable Minister. Even though the Honorable Minister was not available at the moment, management made themselves available to receive the petition on behalf of the Honorable Minister. So that when the Honorable Minister comes back, we would inform him or convey their message to him.
Okay. Now, the crux of the crux of their petition is that they've been home for over 5 years. They haven't been employed. They have been engaging you, the ministry, but they don't see any commitment coming from you. Why are these people not employed as of now, when we know that we do have deficit when it comes to personnel to work at our various health posts?
Yes, that is why the Honorable Minister himself met the leadership of this same group about a month ago. And then the Honorable Minister, Honorable Kwakwajuman Menu, made it clear to them that he himself is going to lead to ensure that they are back or they are employed so that they can be posted to their various places of work to start work. Now, what happened is that this group are under the Medical and Dental Council. At the end of their certification and everything, their names are submitted to the ministry, and then the ministry now writes on their behalf for clearance from the Ministry of Finance. Until the clearance is given to the ministry to recruit them, the Ministry of Health cannot recruit them. Because if you recruit them, at the end of the month, you would have to pay them. Okay. And so if you're getting clearance to recruit them, then it means that if you recruit them, you will not be able to pay them at the end of the month. That does not mean that the Ministry of Finance is not working on their clearance. the Ministry of Health, the Director HR, and then the Ministry of Finance is in serious collaborations. Last Friday, I personally sat in a meeting to make sure that these clearances are worked on so that we'll be able to recruit this crop of physician assistants who had finished with their certification and everything. Okay. Currently, we just finished recruiting the diploma nurses for 2019 batch. We have the allied health workers that we are working on. We have the physician assistants that we are working on. And so it is not something that the ministry is leaving them behind. Okay. We are meeting their leadership on frequent basis. So this whole thing that happened this morning took us by surprise. Nobody informed us that they were coming to us.
Okay.
All right. That they came to fight on us with the police.
Okay. So we have to end it. But you mentioned a meeting in which you're working on their clearance. When is this clearance going to be given such that they can be employed? 5 years is enough a time for you to work on it, isn't it?
Yes. Over the period 5 years that we are talking about, there have been a number of issues that came in.
Anyway, I understand, but I'm asking that in this meeting you speak about, in the next 30 seconds, what was the outcome in terms of getting them employed?
There is the need for us to come back again to satisfy the list that we submitted to them.
Okay. All right.
So we are going back there next week, this Thursday, to meet the Minister of Finance again so that we can take a concrete decision on when exactly we can get clearance so that we pick this. I'm
grateful to you for joining us here. He speaks for Ghana's Health Ministry. Now,